8 weeks ago, when I phoned PPH, we had an A&E department, as far as I was aware. They said that there's a 24-hour A&E department there. 4 weeks ago, we went down, Tony, Brian and myself, down to Haverfordwest to meet with the Hardar board, and they told us they wanted to remove the A&E sign because it was no longer valid. That was a bit of a shock to us, and we thought, well, are we right to be surprised about this? Well, yeah, I think we are, because when we actually looked at it, these emergencies cannot be treated in Prince Philip Hospital right now. There's no surgical emergencies, no acute medicine, no cardiology, no trauma, no emergency children treatment, no head injuries, maternity, gynecology, ears, nose, throat and eye, and more recently they're after Ward 5. Without any consultation whatsoever, they've stolen our services. Right. Then they're centralising them in Carmarthen, and in the future they plan to centralise them in Withybush as well. That's our accident and emergency department gradually going. For too long, the general public of Llanelli have had the mistaken perception that they may lose their local accident and emergency department, when in fact Prince Philip Hospital has not possessed such a unit for a number of years. Now that's the man in charge. Now, you hadn't told me before, I don't know, anybody else knew about that? I would like him to explain why is it better for the people of Llanelli to have the emergency service provision in Glangwili rather than Prince Philip. Why would that be outdated? Can anybody answer that? I don't see it. He asked us to read the Health Board's discussion document. I would ask you to read the Health Board's discussion document. I've read it, and it's uncosted, unproven, non-specific document which talks in vague terms of a utopian impractical solution based around clinicians and not delivering a viable or realistic service to the public. But look for yourself. Have a look for yourself. Next to his letter, there was another letter. This one was from a 78-year-old man who took his wife into A&E at Prince Philip at 9 o'clock in the morning, where she was seen by the excellent staff and tests were carried out. But her pain was not relieved, although they tried, but because we don't have a urology department in Llanelli anymore, they took the tests and they said, take your wife to Glangwili A&E with the test results, because they didn't have an ambulance to take her. And we're talking 78-year-old people here, not 20-year-olds. They got there at 5 o'clock in the evening. At 6:30 that evening, remember she started at 9 o'clock in the hospital in the morning. At 6:30, she still hadn't been seen. She'd been in agony all this time. She didn't get seen till 8 o'clock in the evening. The consultant left to check with colleagues and the gentleman returned home at 11 o'clock so he could get some rest, leaving his wife at Glangwili. At 1 o'clock in the following morning, his wife was told there was actually a bed available for her now, but the consultant couldn't do anything for her. He could only relieve her pain with some painkillers. At 2 o'clock, his wife was discharged. She asked the nurse, can I stay here till 7 o'clock? They said, no, you have to be picked up. At 2:30, a 78-year-old man drove through the night in icy conditions up to Carmarthen to pick up his wife to take her home. And they wonder why we don't believe that the service is working. But in my opinion, it's not. Can we trust them? Can anyone trust them? They've cheated us out of our services. They're using the money set aside to provide services for the people of Llanelli, and there's a lot of us in Llanelli, to centralise services in Carmarthen and Withybush. And that's exactly what they're doing. We must get them back.